to Dr. Anas Saad, right? He's going to talk about the risk of chronic myeloid leukemia in female breast cancer patients. U.S. population-based study. Dr. Anas from where?
I'm a final year medical student at Ain Shams University.
Welcome, Dr. Anas.
So in this presentation, I'm going to talk about the risk of developing chronic myeloid leukemia among breast cancer survivors. First, I want to declare that we have no conflict of interests and will not receive any fund for this project. I would like to thank the members of our team, especially our supervisor, Professor Mohammed Shinnawi, Professor of General Surgery at Ain Shams University. As we all know, breast cancer is the most common malignancy worldwide affecting females. Many previous studies had associated the breast cancer with other primary malignancies following treatment, and many studies associated it with leukemia especially, but no strong evidence is present to associate breast cancer with the incidence of chronic myeloid leukemia. So we decided to conduct a retrospective cohort using the SEER database of the National Cancer Institute in the United States to study the association of breast cancer followed by with chronic myeloid leukemia. We included patients with breast cancer diagnosed between 1992 and 2014, and we followed these patients for the development of CML. Then we calculated the observed over expected ratio and compared this ratio compared it with numbers in the general population. We reviewed more than 400,000 patients with breast cancer. Of these patients, about 178 patients developed later CML. The observed over expected ratio was increased significantly with 1.26 increase. When we divided these patients according to the latency period, we found the increase to be higher within the first 5 years following the diagnosis, and the observed over expected ratio was increased significantly with 0.45. Most cases in our sample were whites. That's because of the U.S. population. When we compared the increase in incidence according to the stage of breast cancer, we find regional breast cancer cases to have an increased risk more than the localized cases. And actually, localized breast cancer cases showed increased risk only within the first 5 years. So in conclusion, we conclude that females diagnosed with breast cancer have an increased risk in developing CML. However, we still need further studies to establish this association and to find the causes of this association. Now, several hypotheses are present for this, including radiation or treatment in general, or radiation exposure, or similar etiologies between CML and breast cancers. Etiologies that could be genetic or environmental exposures. Actually, the genetic predisposition can link both cancers, but most authors think that radiation is more likely to be linked with this. Moreover, other studies are needed to compare the survival of these CML patients with the survival of CML patients without breast cancer, so we can determine the possible effects of screening programs or for interventions on this population. Now, our study was limited by several factors. Most importantly, its retrospective nature and the presence of missing data. We also didn't have sufficient information about systemic chemotherapy and treatment in general. So thank you.
Thank you, Dr. Anas. I'm so happy to find the medical student to present an abstract. It really made me happy, especially you are from H. Shams. Thank you, Dr. Anas.
Thank you.